Anti-cancer therapy can place many demands on you as you go through treatment, both physically and emotionally. For some people, it can affect their ability to work or their lifestyle. Others may be concerned about its impact on people important to them, such as their family and friends. Treatment affects people in different ways. Some people can find they continue with many of their usual activities, while others find this more difficult. In this film, we will give you some advice, hints and tips on things you can do to help and where you can seek help and advice. Tiredness and fatigue are common side effects of anti-cancer treatment. You should expect to experience some tiredness, although how much and how it affects you will be different for each person. One of the things you can do to try and help manage fatigue is to try and get a good night's sleep. This can be easier said than done, but things that are known to help some people include going to bed and getting up at around the same time every night, keeping an hour to relax before you go to bed, having a bedtime routine, and avoiding long naps in the day. You can also try to balance your activity so you save your energy for the things you want or need to do. Planning ahead so you aren't rushing and asking other people to help with mundane household tasks are just some of the ways in which you can do this. Research has shown that gentle exercise can help reduce fatigue. How much exercise will depend on your fitness and your usual activity, but it can have emotional and physical benefits. There is plenty of advice available on exercise and cancer treatment. Please ask about this. For many people, fatigue is much more than feeling tired. It can affect your mood and emotions, how much you feel you can do, your ability to concentrate, your social life and relationships with others. There are things you can do to help manage fatigue, but one of the most important is to recognise that it is an expected side effect of treatment. Don't push too hard, ask for help, and be kind to yourself. Anti-cancer therapy can affect how much you want or feel able to eat and drink. Your appetite may be smaller than usual, and you can have taste changes or may experience nausea. Advice that can help you eat well during treatment include try eating smaller meals and nourishing snacks every 2 to 3 hours, rather than large meals. Keep snacks handy for when you feel you might manage them. Make sure that you drink plenty of fluids, at least 6 to 8 cups or glasses every day. It is quite common to go off tea, coffee or hot chocolate, but do experiment with other drinks. It is important to find a drink which you enjoy. In most cases, it should be fine to have the occasional small glass of wine or beer, but be aware that it can increase some side effects. You should not drink alcohol on the day of your treatment. If you are experiencing nausea, feeling sick, do take your anti-sickness tablets as advised. If they are not working for you, please tell us, as there are many different anti-sickness tablets and we can find one that works for you. Drinking and eating as well as possible can help you cope with treatment, so please read our leaflet, Eating Well During Chemotherapy, that has been written by our specialist dietitians. Some anti-cancer treatments can cause mouth problems such as pain and an increase in the risk of mouth infections. Looking after your mouth is important to try and prevent problems and manage them if they occur. Follow the advice in our Looking After Your Mouth leaflet. Looking after your mouth involves simple measures that are easy to do, like brushing your teeth twice a day with a fluoride toothpaste. This helps keep it clean, while rinsing your mouth with water after eating can remove any food that may have been left behind. Using a lip balm can help keep your lips moist. It is a good idea to check your mouth regularly. Look for redness, white patches or ulcers, and ring the advice line if you notice anything that might be a problem, as they can advise you what to do. While you are on anti-cancer treatment, you may be at greater risk of developing bleeding gums from mouth infection. For this reason, we advise you not to have dental work during your treatment. If you have dental work, you must tell your dentist that you are receiving anti-cancer therapy beforehand. This even includes a scale and polish. Before you have any treatment for your teeth, you will need a blood test to check your white cell and platelet counts. Ask the chemotherapy team for advice. Having cancer and receiving cancer treatment can bring about a wide range of feelings and emotions. Emotional reactions will vary between people, they can change over time and they can come and go. Some feelings that many people with cancer describe include anxiety, fear, anger and sadness. These are normal reactions to a very difficult experience. Talking with others can be helpful, and you may have family or friends who you can share your feelings with. There are also many other sources of support, such as local cancer information and support centres, who provide a range of services. If you find your feelings are overwhelming or difficult to manage, please speak with the doctor, nurse, pharmacist in the cancer team or your GP. Before you start treatment, you may not know how it will affect your work and social life. Some people don't feel well enough to work or be socially active in the days immediately after treatment, and then start to feel more able to do this as the effects reduce. Others may have a different experience. Some people want to carry on working while they're on treatment and feel well enough to do so. Being able to change working hours or patterns to fit around appointments and treatment can help with this. Some people prefer not to work until their treatment is completed or do not feel well enough to do so. It is difficult to know how your treatment may affect you before you have it, so you may need to make a decision about work after your first treatment. The doctors and nurses may be able to give you an idea of how people often feel with the treatment you are receiving, so please talk to them about this. Advice on finance, benefits and work is available from the Cancer Information and Support Centre. People often schedule social events and activities to the days when they are more confident they will feel able to enjoy them. Again, this is something you will know more about after you have had your first treatment. The way treatment affects you can change as you go through treatment, so you may need to be flexible with your plans. There is plenty of support and advice available from local cancer information and support centres. Please contact or visit them to see the range of services they offer. There are also plenty of online resources for hints and advice about living well on anti-cancer treatment, including Macmillan, Cancer Research UK, and charities for specific cancers. We hope this short film has been helpful. If you have any concerns or questions about your treatment and how it may affect you, please ask.